Good morning, everybody. It's another Tuesday after Labor Day for those that live in the United States. I hope that you had a great weekend and that this week it's full of new adventures and wonderful miracles. So, today I want to talk about herbal medicine during the IVF process. For those of you that have discussed your supplements with me as you're going through your fertility journey, I am very emphatic about discussing the herbal portion of your supplements to a lot of detail because there is a lot of herbal drug interaction that occurs that people are unaware of, and that is very important to be careful for. I have seen multiple times where there is a compounded effect of several herbs, for example, that affect coagulation, and then the person is doing aspirin and Lovenox or low molecular density heparin, and and then there's a bleeding issue that arises. And when you look at the medication side, it's a little surprising, but when you start actually discussing with the patient what else are they taking, then you see that potentiation that happens from the herbs with the anticoagulation medication. That is one of the examples. So I know that a lot of you are trying to take herbal medicine, one, to handle the stressors that come with fertility treatment, stressors, anxiety. Some of you take the herbal medicine thinking that you're actually improving your hormone panel, especially if we're dealing with low ovarian reserve. But I want to point out a few of the herbs that are commonly used, and people are not aware of a few of the other interactions or actions of the herbs. After all, medicine, drugs actually come from plants and herbs. So I usually do not recommend herbal medicine during interventional fertility treatment with medication, IUIs, IVF, etc. So a very common one that I see all the time is ashwagandha. I love ashwagandha. Ashwagandha is a fantastic herb. It calms the nervous system down. It's adaptogenic. It decreases cortisol levels, stress levels. Personally, it's fantastic to help me sleep at night, get my cortisol down. The monkey brain to calm down. However, ashwagandha does interact with coagulation. It actually decreases the effectivity of fibrogen and some of the enzymes that activate your platelets. So ashwagandha, it's a big no-no while you're doing IVF, especially if your doctor is putting you on any form of anticoagulant, even if it's just aspirin. Okay. Ashwagandha also, one of the effects, it decreases testosterone. So, on a population with decreased ovarian reserve, ashwagandha could potentially be detrimental to your egg quality, especially if you're borderline testosterone, borderline DHEA. I know that DHEA is talked in the fertility world like it's a supplement, and it's not a supplement. It's actually a testosterone that is mostly produced by the adrenal gland, and in functional medicine, and we see it as a marker for adrenal health. So if you're borderline on the DHEA testosterone end, that is very important for egg quality, then ashwagandha actually will drop it further down. It's a natural way of decreasing testosterone. So if you're having low ovarian reserve or you're doing IVF, no ashwagandha. All right. The other one that I personally also adore is licorice root. Licorice root is fantastic also to help the adrenal, calm the cortisol level down. It's a fantastic calming herb, but it does have a few contraindications. One, in certain people, will increase blood pressure. So if you have a tendency to have blood pressure problems, then licorice root might not be the calming herb for you. So you have to be very gentle when you start taking any licorice root containing supplements. Also, it does interact with the coagulation cascade, especially with aspirin. Okay, it tends to inactivate platelet formation. So again, A lot of the, for example, stress combination herbs will have both ashwagandha licorice because they're so wonderful to do those things, but it might not be wonderful for you when they start interacting with your IVF meds. Okay. Another one that is broadly used is St. John's wort. St. John's wort, it's a wonderful natural antidepressant. It works similarly to the SSRIs in terms of trying to maintain slightly higher levels of serotonin. It is obviously gentler than a Prozac, for example. However, because it has a similar mode of action, it should not be taken while you're taking any other antidepressant. That is one thing. And it also inhibits coagulation. So if you are going through the IVF process, again, you should not be taking St. John's wort. St. John's wort is also a fantastic antiviral. It helps the immune system. So I use it regularly in my functional medicine practice, but I do not recommend routine herbal medicine during IVF because of the drug herb interaction. Now, what can we take, right? This is very stressful. I can't sleep at night. How do I handle my stress? I always recommend more natural ways, even though herbal medicine is considered natural, but it's still an intervention. So, go for a walk, meditate, take time for yourself, massage. You can do light therapy, for example, infrared light therapy will also calm your nerves out, especially if you're able to put the red light, not the infrared over the eyes, but the red light over the eyes. It can be very soothing for the brain. Music therapy can be very, very huge as well. Acupuncture. Okay, you get the picture. In terms of the herbs, safe during IVF treatment and pregnancy, we got valerian root. Taken at night, it tends to make you feel a little sleepier, calm you down. Chamomile, both in tea form or pill form, which will have more active ingredients. Lavender, both as a aromatherapy, but also on the skin. And you can actually have lavender tea. So you can have a combination of those things. Passion flower is another calming herb that can be used. Holy basil. Holy basil is one of my favorite herbs. A lot of times it gets combined with some of the other herbs I've been discussing, but by itself or in combination with the lavender and the chamomile or valerian could be something that you can take to calm you down at night, or if you feel a little agitated, a little stressed out during this process. Another one that is absolutely huge, and that is something that I regularly recommend to my IVF patients, are glandulars. We're trying to support the adrenal gland, which is the gland in your body that handles stress. And that's where the DHEA component comes in, because DHEA is a marker of adrenal health, like I was saying earlier. But glandulars, take adrenal desiccated. There's several companies out there that formulate wonderful adrenal supplements. The adrenal gland needs a lot of vitamin C, so a food-based vitamin C to support the adrenal gland. Whole endocrine system glandulars, like the female endocrine pack, that is one of that I recommend a lot. And one of the reasons is, again, to support the whole endocrine system: hypothalamus, pituitary, thyroid, adrenal, and ovaries in the case of the female. So glandulars and nutrient manipulation, for example, magnesium, it's a great nutrient that is not going to harm you. You take it at night. It's very calming. It's a natural muscle relaxant. It's going to help you go to the bathroom without giving you the cramps of a laxative, and it'll calm your brain. So magnesium at night is also a big one. Minerals in general tend to be very calming. I like a powder, like a drink that it has very bioavailable magnesium, calcium, and potassium in different concentrations that I take at night. And I tell you, it knocks me out like it's a sleeping pill. And being a liquid form, it is faster absorption, so the effect is a lot more powerful. So there are things that you can do to help you cope with all of this process that I know can be very stressful, but herbal medicine you want to be very, very careful with. So I do recommend that if you want to be on some form of herbal medicine through this process, and remember, you're trying to get pregnant, so it has to be safe in pregnancy, that you reach out to a functional medicine doctor or your naturopath or your acupuncturist and discuss the final details with them. And as always, you're always welcome to reach out to me, and I can look through what you're taking and how to create a protocol that will work for you and with you through this fertility journey. All right, guys, I hope you are all very blessed the rest of this week, and I will see you next time. Bye bye.